Hi, my name is Brendan Graham. I'm one of the medical registrars at the Rockhampton Hospital working in the Department of Medicine. At Department of Medicine here we have a number of different subspecialties which includes cardiology, renal, oncology and general medicine. So I've always had quite a passion for working in general medicine and sort of diagnostics. I guess it's one of the few times where I've been a bit interested in the concept of like house and those sorts of programs. And general medicine is where you do get a bit of an opportunity to put a bit of the diagnostician hat on and explore some of the complex natures and the multiple problems that patients have and be able to put it together a bit like a puzzle. And that's always fascinated me to be able to work through complex patients. Rockhampton's been really a change for me. Previous places I've worked with have not had any subspecialty areas. It's just been all general medicine. It's good here in Rockhampton because the fact that there's only a few subspecialties means that you get to do a lot more for your patients. When I've been exposed to places such as Brisbane, oftentimes the subspecialties will take the patients and so you may not get an opportunity to be exposed to those, whereas here in Rockhampton we have quite a team approach, so oftentimes we'll be co-managing multiple problems with subspecialties rather than a unilateral sort of decision making from them. So what I've loved working regionally is that I've been exposed to a lot of learning opportunities that I wouldn't have otherwise been able to. I've been working regionally ever since I was an intern, and that's allowed me to look after quite sick patients very early on in my career. Been exposed to procedures, being able to start making independent decisions much earlier on. And by doing so it means that when I've moved into a registrar role I've been able to work much more closely with the consultant to make patient decisions and care decisions, which has been exceptionally rewarding. I've had a lot more opportunity to do procedures and gain more procedural skills as there's not a huge number of other registrars that I'm competing with to try and get those skills with, and that includes people that are doing RMO roles or even intern roles here. The other big advantage is that instead of having to follow what the consultant directs, which is often what happens in most large tertiary centres, it's more of a one-to-one relationship where you get to co-manage the patient with the consultant, as well as in some instances make independent decisions and guide the care of the patient directly, which working through that process as a trainee definitely helps you understand how consultants think and makes it a lot better, I find, when you're studying through with your material to have an understanding of the theoretical applications to patient care. So in terms of the application process, there's not really any special tips per se, but what I would always recommend is to have a chat with the physicians that you work with if it's in something that's of interest to you. They can then guide you on those particular things that you might want to focus on. But what I've found useful in my experience has been just working through the wards and taking additional general medical terms to get as much exposure to general medical patients as possible. Rockhampton's interesting in the sense that it's not very competitive due to the fact it's regional. It does also mean though that because it's regional, it may be a slightly different training experience than what you would be used to working in a big city like Brisbane. To become a physician in general medicine, you'll need to apply for fellowship to the Royal Australasian College of Physicians. Fellowship is a 6-year full-time training pathway, which involves 3 years of full-time basic training in adult internal medicine, followed by 3 years full-time advanced training in general and acute care medicine. The 3 years full-time basic training in adult internal medicine consists of 2 years full-time core training, which is 3 months in general and acute care medicine and 1 year in medical specialties, which is followed by 1 year full-time of non-core training. Completing basic training in adult internal medicine allows doctors to train in general and acute care medicine and/or specialise in one of the 26 medical specialties available in the advanced training program. Advanced training in general and acute care medicine is a further 3 years full-time, which consists of 2 years full-time core training and 1 year full-time non-core training. The entry requirements for basic training include general medical registration with the Medical Board of Australia. At the earliest entry is postgraduate year 2, a secured basic training position at an accredited training hospital or health service, discussion of your application and receiving approval to apply for basic training from the network or hospital director of physician education. The Director of Physician Education's approval is subject to the selection process, training capacity and/or performance of the prospective trainees. Australian trainees are required to have their online application approved by their respective Director of Physician Education. Prerequisites to commencing advanced training are the completion of RACP basic training, which includes the written and clinical examinations, and secured employment in an appropriate advanced training position. Applications and selection process in Queensland for the first year basic training positions are managed directly and recruited by individual hospitals and health services, not via the network. The college is not responsible for trainee recruitments. Information relating to the training positions in Royal Australasian College of Physicians Accredited Hospital for basic training is accessed via the Resident Medical Officer Campaign website and available positions within each hospital. The Queensland Basic Physician Training Network provides centralised recruitment, selection and allocation of basic physician trainees intending to commence their second or third year of training in Queensland and are registrar level appointments. To proceed to advanced training, applicants can secure an advanced training position at an accredited training site by applying through the Resident Medical Officer Campaign to the Queensland General Medicine Advanced Training Network. The network facilitates centralised recruitment to general medicine registrar positions across the state from first year advanced training. Trainees remain on the network for the duration of their general medical advanced training, subject to satisfactory performance. Once you have secured an advanced training position, you must prospectively apply for approval as per the RACP progression through training policy. So I found that working in Rockhampton and even in other regional areas, you tend to have to form a bit of closer relationship with people in the community because otherwise it can be a bit isolating to people. But in doing so, you get quite a lot of exposure to a lot of community activities and community engagement, and that makes it quite a lot of fun in general to have outside of work life. It's also been really good being in Central Queensland. There's a number of different areas that you can go to. So Yeppoon's only a stone throw away, so you can spend plenty of time in the beach there. There's Keppel Island, which is a great place to stay if you like sort of a bit of an island style stay. And there's certainly other places inland that people can explore if you enjoy four-wheel driving and things like that. There's lots of things around that area as well. I've also found it's good, the time to drive into work is really quite short. There's not a lot of traffic, or peak minute as I tend to call it in Rockhampton. So that's quite advantageous as well. So I guess my time here I found really rewarding, and that's why I would strongly encourage people that want to have a bit more independence and a bit more active role and have really close one-to-one relationships with their consultants when they're learning. It's definitely been a really good experience here, and I've been able to really grow into a physician trainee working in this role.